Paul Davis.
Diolch, Dir Brylwydd. Trefnydd, I'd like to request a statement from the Minister for Mental Health and Wellbeing regarding children and young people's mental health services in Wales. A local mental health charity in my constituency called Megan's Starr Foundation has contacted me because they have been asked to take on cases that actually belong in the hands of statutory services. They shared with me a case where they were contacted about a 16-year-old girl. The girl spent several nights in hospital following a second suicide attempt in 3 months. She's now experiencing terrifying psychotic symptoms, and yet child and adolescent mental health services only offered her a 2-week support window and passed the girl on to Megan Starr's Foundation as a charity. Now, they are concerned because this is not an appropriate or safe handover of care. It's quite clear that high-risk children are being discharged from CAMS into the care of charities, and we must investigate why that is taking place. Therefore, I'd be grateful if we can have an urgent statement from the Welsh Government on support for mental health services so we can understand why this is happening and whether financial support could be made available to local charities and organisations who are taking on these extra responsibilities as well. Diolch.
Paul Davis, and thank you for drawing attention to this very concerning case in your constituency. And can we recognise the really important role of those charities, national and local mental health charities that we do, and we, of course, we support many of those charities with grants and support from the local councils of voluntary service. This is something which you've heard it today in the chamber. It is for Hywel Dda, I think, to not only hear this particular case, but look at this in terms of their services. And of course, the Minister for Mental Health and Wellbeing, I'm sure, will also hear of this and would want to respond in terms of her vision, which is very strong and clear for not only improving but sustaining and supporting mental health services for young people.